Hello, I'm Joycie Smith. I'm a physician in Northern California. I have a wellness clinic in the San Francisco Bay Area, and we're listed under joyciesmith.com. We're doing functional medicine with an emphasis in weight loss and functional pain management. Well, I grew up in the Chicagoland area, Chicago, Illinois. Went to Oak Park Road Forest High School and then on to University of Illinois. I then decided to go to University of Chicago, Pritzker School of Medicine. I ultimately decided that after a transitional internship in Hawaii, and that was really hard to leave, I then continued on to Harvard's Brigham and Women's Hospital, where I did my anesthesiology training. I have been practicing since about 1999. And then in about 2007, I kind of said, something here is not working. They say the definition of crazy is when you do the same thing over and over expecting different results. And that's what I was noticing in traditional allopathic medicine. I decided at that point in time that it's time to do something very different. So I decided to join the American Academy of Anti-Aging, and also I'm doing a fellowship program, and I do all this to bring about my own concept of what medicine should be, which is the functional medicine model, is that you can either throw pills at the diseases themselves or you can treat the whole person. And once you treat the whole person, you don't need to take medications for the symptoms of the diseases, because the diseases will either ameliorate or completely go away. The first tool that I use is actually quite a simple one, and that is looking at the nutrition. Look at what you're eating every day, the type of foods we eat, the timing of when we eat those foods, and also the pollutants and the toxins that we need to avoid when we're selecting our foods, our vegetables, and whatnot. Next, we look at nutraceuticals, phytotherapy to support those diets, and that can be anything as simple as like astragalus, for example, which is used a lot in Chinese medicine, that helps to supplement the immune system, decrease cough, decrease colds, to vitamin D, which is huge in the news right now because it's being shown to be as important, if not important, more important than vitamin C. So we move on then from diet, nutraceuticals, supplements, and we start saying, okay, well, how do we need to support you until we can get you to the point where you're not needing to be on medications? And we look at pharmaceutical medications you are taking, and we say which ones are necessary, which ones are causing nutritional depletions, and we replace those. All of this is happening at the same time that we start to support vital systems such as the adrenals, where we start to detox the body, detox the gut especially, because if you don't detox the gut, nothing else works. And then we also are looking at our hormonal axes and getting that in play to optimize. So the idea is that it's not about getting you someplace you can't go, it's taking you where you are right now and making you the best you can be, looking towards the future of making you more energetic, happier, getting out there, exercising, and enjoying life again, finding that vitality we had when we were children, high school, college, that I think many of us in our high-stress lives just lose. But it goes back to the fact that most disease processes, especially in America, are all either caused or preventable by what we're taking into our bodies. One of the things that I also wanted to utilize my anesthesia expertise is within the field of functional medicine is functional pain management. And I state this is very different from traditional pain clinics. Pain clinics tend to either be pill mills, that means you go in, you get your prescription, you go away for 30 days, you come back, get another prescription, go away for 30 days, rinse and repeat for the rest of your life. And it's just not taking care of the underlying issues of pain. The other options are what we call block shops. Anesthesia, pain management clinics that specialize in epidural steroid injections, celiac plexus injections, or injections that mean to go to the target nerves and quiet that down. The good thing about it is that it can be highly effective for many people, and it can kind of bridge you in a situation where you're trying to go to the underlying cause of what's happening with your pain syndrome. Unfortunately, for some people, it's kind of like the pill mills in that it's not bridging, but a temporizing pain relief mechanism. The idea behind functional pain management is to say, okay, while we're doing these things with the pills, while we're doing these things with the blocks, which can really help and do help a lot of patients, let's get to the underlying cause of the pain and see if we can also take care of that mechanism. A lot of pain starts out structural, meaning there is something physically wrong with the body, but very quickly becomes functional in that the physiology of the body around pain becomes deranged, and that needs to be addressed to fully augment what's going on with your other pain management regimen. And that's what the functional medicine model does. I'm located in Northern California in the San Francisco Bay Area. If you're familiar with it, there's a little island called Alameda. You can find all that information on the website, joyciesmith.com.